Quality, the Department of Human Services Administration budget, and the Department of Housing and Community Development. We will begin with OHCQ, so we'll start with the analysis presented by Ann Wagner.
All right, thank you very much, Mr. Chairman, members of the committee. As you just said, today we'll be presenting the Office of Healthcare Quality's budget for this year. This is an office under the Maryland Department of Health, which licenses and certifies several types of healthcare programs and facilities for compliance with state and federal health, safety, and quality of care standards. The fiscal 24 allowance provides about $34 million for this agency. And I'll skip to page 3. Exhibit 1 shows that the allowance by use of funds, demonstrating that over 90% or $30 million supports personnel. Exhibit 2 on the next page shows the amount of personnel costs split across the office's major monitoring units. The long-term care unit makes up the largest share of personnel costs, followed by the unit that surveys and licenses developmental disabilities administration providers. Exhibit 3 on the next page is showing an itemized list of changes in the allowance compared to fiscal 23 working appropriation, and those changes net to an increase of $1.2 million. Almost all of the increases in expenses are driven by personnel costs. The largest change is salaries and fringe benefits for 10 new positions, and I'll talk about that a little later on. Moving on to recent personnel trends, Exhibit 4 on page 7 shows that vacancy rates and the number of filled positions for OHCQ have fluctuated over the past few fiscal years. Starting February 2021 through the end of fiscal 22, vacancy rates generally grew and eventually reached a high of about 19%. Fiscal 23 year-to-date has shown some improvement as OHCQ was able to fill a net 11 vacant positions, and the most recent vacancy rate had decreased to 13.3%. On the next page, the analysis discusses OHCQ's budgeted turnover. This is a negative adjustment to salaries in each budget that accounts for vacancies throughout the fiscal year and the time that it takes to fill those positions. Typically, when an agency reports consistently high vacancy rates, the budgeted turnover would also increase to coincide with that. And so from fiscal 2019 to 2022, as OHCQ reported vacancy rates around 10% or higher, the budgeted turnover rate had also increased to 9% in fiscal 21 and 22. However, you're seeing in fiscal 23 and 24, OHCQ's budgeted turnover rate is set at 0%. By keeping the fiscal 24 budgeted turnover rate substantially lower than current vacancy rates, OHCQ is estimated to save about $3.5 million in personnel funding that would have been spent on salaries and fringe benefits for filled positions. And so on page 9, OHCQ is asked to discuss how it will use those personnel savings from having vacant positions in fiscal 23. And then based on OHCQ's recent vacancy rates remaining above 10%, DLS recommends increasing the budgeted turnover in the allowance to 7%. So then moving on to the key observations section, OHCQ has certain mandated inspection requirements for its survey activities across each monitoring unit. Exhibits 6 and 7 show that the office's survey rates through fiscal 21 have consistently fell short of the goal of surveying every licensed DDA provider and assisted living facility annually. Exhibit 8 on page 12 shows the long-term care unit's recent surveys through fiscal 21. The number of surveys grew considerably during the pandemic as OHCQ had to temporarily conduct additional surveys directly related to COVID-19 infection control. OHCQ was unable to provide fiscal 22 survey data and has not submitted managing for results performance data for this year, while the office is still reconciling survey information and records that were collected during the ransomware attack on the department. The ransomware attack occurred in December 2021 and led to OHCQ surveyors losing access to the database that they use for tracking and managing survey results until May 3rd, 2022 is when they were restored back access to that database. OHCQ is still in the process of re-entering survey data from that period, and so the office is asked to comment on whether it will be able to reconcile and add all fiscal 22 survey data onto its database and when it expects to submit fiscal 22 actual survey data. DLS recommends adopting narrative, requesting that the office provide fiscal 22 actual survey data and a status update for restoring all OHCQ operations and meeting reporting requirements following the ransomware attack. The next key observation discusses mandated staffing support provided in the allowance. Chapter 454 of 2018 mandated that OHCQ receive 10 new positions each year from fiscal 20 through 24 to help the office in meeting its mandated survey goals that were just discussed. Exhibit 9 on page 14 shows that the distribution across monitoring units with the fiscal 24 allowance, providing the last installment of 10 new positions, totaling 50 new positions over the period shown. The long-term care unit and developmental disabilities unit received more than 3/4 of the new positions over the period. However, when accounting for position transfers within the department in fiscal 24, the long-term care unit ends up with a net reduction in positions. And so OHCQ is asked to explain why positions are being transferred from the long-term care unit in the allowance. And finally, OHCQ is asked to discuss how the 50 new positions have impacted staffing adequacy, how the office is assessing its personnel needs beyond fiscal 24, and whether a new staffing study is in progress. And then on page 16, that shows the recommended actions that I just walked through, and I'll conclude the presentation. I'm happy to answer any questions.
Sounds good, thank you. Are there any questions for the analyst? All right, seeing none, I'd like to bring up the department. We'll bring up Secretary Scott and Dr. Ney, along with anyone else on your team that you want to bring up. My agendas no longer list everyone, so bring up whoever you like. Welcome, Dr. Scott. Thank you for coming. Congratulations on what I hear was a very successful Senate confirmation hearing yesterday.
Thank you.
So I hope to not have to call you acting secretary for much longer.
Me too.
Please, go ahead.
Good afternoon, Chairman Resnick, Vice Chair Chang, and members of the subcommittee. I am Acting Health Secretary Laura Herrera-Scott, and with me is Dr. Jinlene Chan, Deputy Secretary of Public Health Services, and Emily Bradenberg, our CFO. I would like to acknowledge Ms. Wagner and the DLS budget team for their insightful analysis and look forward to working with them and the committee staff during this budgeting process. Before I turn it over to Dr. Chen to go through our budget responses, I wanted to make clear that the Office of Healthcare Quality plays an incredibly vital role in ensuring that our licensed healthcare facilities follow federal and state requirements to keep patients safe, healthy, and protected. Ensuring that OHCQ functions well is a priority. We're just beginning to do a deep dive with Drs. Chan and Ney, along with our human resources and finance teams, to help replenish and recharge OHCQ from the effects of COVID-19 and the 2021 MDH network incidents, which we're still dealing with as described earlier, and to lay the foundation for the next few years in the staffing plan that was put in place in 2018 as that comes to an end. I look forward to discussions with you and your colleagues as we conduct our planning work. I will now turn it over to Dr. Chan, who will go through our summary response to the DLS analysis, and then we'll take questions at the end.
Thank you, Madam Secretary, or Acting Secretary. Again, we do hope it will be short and short time. Thank you. Good afternoon, Mr. Chairman, members of the committee. For the record, again, my name is Dr. Jinlene Chan. I'm the Deputy Secretary for Public Health Services with the Maryland Department of Health. I'm really glad to be here today. So I'll be discussing, of course, the OHCQ budget and the responses to Ms. Wagner's always very detailed and appreciated analysis and presentation. You should have in front of you a more detailed written response to some of the questions that were posed in the analysis. However, I will provide just some highlights to that. The first question that was posed was about the potential uses of the anticipated FY23 turnover savings, as well as what our efforts have been to hire and retain staff. We would respectfully disagree with the recommendation to increase the turnover and would support what is currently allocated in the governor's allowance. The OHCQ has been diligently filling all vacancies, as you can see from this past year's worth of data. And really, this is one of our top priorities, and Dr. Ney continues and continually recruits, interviews, and hires individuals. And in fact, since July, so about 8 months ago, 8 months ago, we have hired and brought on an additional 53 individuals into the office since July 1, including over 30 surveyors. And so that's really critical because that, of course, is the crux of the work that we're doing. As of January 31st, OHCQ has right now 25 vacant positions, and we're in the process right now over the last couple of weeks interviewing for 21 of those positions, all of those surveyors. Our recruiting and retention efforts really over the last several years have increased. We have established improved promotional opportunities for staff. We have allowed more flexible work schedules for staff, as well as using the available state tuition reimbursements, again, creating opportunities for staff growth and promotion. To the extent that there are any general fund vacancy savings, they will be used to be able to account for any anticipated decreased federal match for nurse surveyors in FY24. The department is not able to generate a federal match for the work being done by those new hires because while they are in training, which typically lasts about a year, we are not able to claim the federal match. And so therefore, the fund split for the merit positions does not fully account for the new hires where the payroll may be charged 100% to the general funds in FY24. In addition, any vacancy savings we also use to support additional special payments payroll staff to support new mandates or other work that the office needs. The next question was about the OHCQ metrics related to the FY24 MFRs and the 2022 annual report, as well as those performance metrics. Ms. Wagner, as she mentioned, the network incident certainly caused us to, across the department, to make sure that we had workarounds, and OHCQ was really one of our top priorities all last year to ensure that the work continued. And so they worked very closely with the regional office of CMS to ensure that there were paper-based workarounds so that surveys and complaint investigations continued. And so once the network was restored in May to OHCQ, again, they were the top priority for the department. Their staff have been inputting all of that data from that 5 or 6 month time frame where they were offline and not connected to the federal system, Aspen. And so the federal surveys were inputted first. Those were the top priority, and they are now completing the state surveys that were done during that time frame. And so you have in your written response a little bit more detail about what is anticipated in terms of when that work may be completed. At this time, all of the federal certification data have, as I said, been completed, and this is data that is critical to us. And so we are, Dr. Ney and her team have been diligently working in addition to all the survey work to make sure that the backlog of data that's inputted is done as quickly and expediently as possible. There has been, and I would really like to emphasize this, that during the network outage, there was no data that were compromised, missing, and there was no need for resurveys. So we would respectfully request that the Budget Committee recommendation not adopt the language for an additional report. Next, I wanted to clarify some of the position movements within the long-term care program. As was noted earlier in this year, so about the time that the FY24 allowance was set, 2 positions had been reassigned to meet some of the mandates, and these were state mandates, not federal, to investigate sexual abuse allegations. And so in that time frame, but since that the allowance was pulled, we actually are now moving 2 positions back into the long-term care unit. So this is something that this office and others typically do to meet the needs and the changing needs, and always reevaluating what might be needed at the time. And last, we were asked to comment on the staffing plan adequacy over the last 6 years, going into the 7th year next year, and also assessing the staffing needs beyond FY24. It is absolutely clear that the increase in staffing over the last 6 years, and as we anticipate next year, has provided the very needed support that OHCQ needed to better meet both federal and state requirements across the state for all of the different provider types. And so what you can see is that we have improved overall, the pandemic and the network incident notwithstanding, our ability to respond to those mandates. And we absolutely have appreciated the legislature's support in that 2018 staffing plan. We do continually assess the staffing resources that may be needed to meet new mandates, for example, as across all of the different provider types that are overseen by the office, including looking at the way that our numbers over time might change because DD facilities, for example, and the number of sites have increased over time. Nursing home numbers and assisted living numbers change also over time, as well as taking into account the impacts of those new mandates that have been passed over the last several years. For example, we're already anticipating that in FY24, of the 10 new positions that the office will be receiving, 5 of them will go to the long-term care unit. So as referenced before, the data that OHCQ staff is currently inputting as part of the annual report is absolutely critical to the planning work that we're doing. We are prioritizing that work to make sure that we produce the annual report not only for the legislature and the constituents, but also for our own internal planning. And so we are beginning the work now of looking forward to a new staffing plan to meet future needs of OHCQ. So with that, Mr. Chairman, members of the committee, we are happy to answer any questions.
Wonderful. Any questions? Vice Chair.
Thank you, Mr. Chairman. Hello, thank you for coming before us today. I really appreciate this update. I'm looking through the written summary that was provided on page 5. You reference in the staffing adequacy section that you all are anticipating that you'll be able to meet federal and state mandates, which is wonderful. Just a question, and perhaps this is better for offline, if I can get more information, please, about the forensic genetic genealogy program. That is a bill that I worked on a couple years ago when the General Assembly passed it, and something I care deeply about. So I would just love to follow up with you offline, please, with an update on what's happening there.
We would be happy to, Madam
Thank you.
Vice Chair. Thank you.
Wonderful. Any other questions? I have a few. 2 quick questions, somewhat parochial. I can't remember how far back, maybe it was a year, maybe it was longer than a year, reached out to the department to ask about updating regulations dealing with tissue bank and plasma collection facilities. The department had promised to put a stakeholder group together to look at those regulations and provide updates. To date, despite numerous inquiries, we have not seen a stakeholder group pulled together, so I'd like to get an update on that and see where we are to get that work going.
So I'm going to have to get back to you on that because I haven't seen anything related to a stakeholder group on this particular issue in the transition documents that I've received, but I'm happy to go back and follow up, and if we haven't done it, we'll get moving on it, but I don't know where we are in that one.
Sounds good. I can update, provide the documents as well, and we can get moving.
That would be great.
The second issue deals specifically with Montgomery County. Over the last 10 years, Montgomery County has enjoyed a memorandum of understanding with OHCQ that OHCQ would provide some amount of budget to Montgomery County, and Montgomery County would then do all nursing home inspections and long-term care inspections within the county on their own through DHHS. DHHS, sorry. Last year, that MOU was canceled and not renewed. We were told it was as a result of federal regulations that no longer allow for that to happen. Since then, it is my understanding that annual surveys have been conducted. I believe 4 annual surveys have been conducted in 3 facilities out of 34 nursing homes in Montgomery County. So what I would love to see happen, one way or the other, is explore whether or not we can restore the MOU and give Montgomery County the right to go back to doing things the way they were, or if we can improve the annual survey rates from the state into the county, because obviously as the largest jurisdiction, we probably have the most number of seniors in nursing homes, and we'd like to make sure that they are being well cared for.
So I do have that one on my list,
Great.
and unfortunately, I could not figure out in time for this hearing why we stopped the MOU. In addition to federal requirements, there was some mention in one of the documents about quality, but I didn't have enough context to say what that meant and what remediation and work did we do with the surveyors in the county. So I'll have to get back to you on that one as well.
Sounds good. Thank you very much. Any other questions? Usually when I ask questions, people start to come up with more, so I just want to double check. Seeing none, thank you all very much. Really appreciate your time. We have 1 witness signed up to testify on this budget. So as the department leaves, we'll bring up Margot Quinlan.
Thank you.
From the Mental Health Association of Maryland. The floor is yours.
Great, thank you so much. Appreciate the time. My name is Margot Quinlan with the Mental Health Association of Maryland. We appreciate the budget report and support the budget recommendations. Just wanted to raise one point and some potential budget language that we would propose, and we submitted this with our testimony, sort of related to what Chair Resnick, you were mentioning around the safety of older adults in nursing homes and assisted living facilities. We sort of lack some of the data that we need here in Maryland to understand if any rates of abuse with misdiagnosing or misprescribing powerful antipsychotic medications, which has been reported nationally that older adults in nursing homes are being diagnosed with schizophrenia at rates of 1 out of 9, when the sort of national average just across the lifespan is 1 out of 40, or 1 out of 150 people has schizophrenia. And part of this is because there's some loopholes with the federal regulations that if somebody has a schizophrenia diagnosis, you don't need to report the prescribing practices there. And so the CMS data that we get is a bit misrepresentative of what might actually be happening on the ground in our nursing facilities and nursing homes and assisted living facilities. And so we're really concerned about just the potential for abuse of older adults, especially vulnerable older adults, and not trying to point any fingers in this moment, but just sort of feeling like we lack the data to really zoom in on what the problem might be here in Maryland. And so we would love to empower the office to help start gathering some of that data and get some more transparency around prescribing and diagnosing of our older adults in nursing home and assisted living facilities. We'd be happy to talk more. Again, we put some budget language in the testimony we submitted, and we'd be more than happy to meet with anyone to talk more about how we could support this.
Wonderful, thank you. Any questions for the witness? Seeing none, thank you very much.
Thank you so much.
Appreciate your testimony.
Appreciate it.
All right, now we're going to move on to the budget for the Department of Human Services Administration budget, and our analyst, Naomi Kimura.
Thank you, Mr. Chairman. My name is Naomi Kimura. I'm here with the Department of Legislative Services, and I'm going to present the fiscal 24 allowance for the Department of Human Services Administration. So the Department of Human Services Administration provides the operational support for all DHS programs and activities, including fiscal management and management of IT systems. As you can see from the first page, the fiscal 24 allowance increases 5.4% to $291.5 million. Turning to page 4, at the bottom of the page, I want to point out one of the performance measures that DHS captures related to children in out-of-home placements receiving appropriate care. So the the Citizens Review Board for Children reviews cases of children in out-of-home placements and assesses if they're receiving appropriate educational and health services, and then makes recommendations accordingly to the corresponding local Department of Social Services. As you can see from the chart on page 5, Exhibit 1, the cases in which children received appropriate education services and received appropriate health services has been declining since fiscal 2019. Service interruption is expected because of the COVID-19 pandemic, but these numbers have been declining since then. There's also a line on this chart, which is either gray or yellow, depending on if you're looking at color, which represents the timeliness of the reports being submitted to the appropriate local office. This took a dip in fiscal 21, but has been increasing. And so I just wanted to point out that this is a data point DHS captures to ensure that children are receiving appropriate care and that timely action is taken if not. On the next page begins the discussion of the fiscal 24 allowance. The fiscal 24 allowance includes two proposed deficiencies for fiscal 23, totaling $16.1 million. The first is for OTHS, the Office of Technology for Human Services, in the amount of $15.3 million to decommission some of the DHS legacy IT systems that are transitioning over to MD Think, which is the Maryland Total Human Services Integration Network, which I'll be speaking about in a couple of minutes later in the analysis. The remaining $879,000 in deficiency appropriation is correcting a fund split issue for Montgomery County block grant. Montgomery County receives its funding for the local social services a little bit differently than the other LDSSs, and so this is just writing that amount for fiscal 23. On page 7, Exhibit 2 shows the breakout of the fiscal 24 allowance. You can see almost 40% of the budget is allocated to the maintenance and operation expenses for MD Think. About 16% of the budget is allocated to other OTHS, IT, and data systems, and then about a third of the budget is going toward personnel costs. The following page, on page 8, Exhibit 3 shows the line item changes for the budget between the 23 working appropriation and the 24 allowance. I'm just going to point out a few items here. So on page 8, you can see a $15 million increase for Amazon Web Services, which is where MD Think is hosted. On page 9, you can see a decrease of $15 million. That's referring to the deficiency I spoke about earlier, decommissioning the legacy IT systems. There's also $3.8 million in rent for the new DHS headquarters in Baltimore City. And then the final line of the table is a decrease of about $3.2 million in the Maryland Legal Services Program. There was a decrease in demand for this service, and there was also increased availability of federal funds. This is to provide legal representation for children involved in SINA and termination of parental rights cases. On the following page, page 10, is looking at personnel in the Department of Human Services Administration. You can see there's a 12.24% vacancy rate, which represents 93 vacancies, which is 51 vacancies above their budgeted turnover. DHS has been experiencing high vacancy rates department-wide, which leads me to the discussion on page 11. So the entire department has 5,970 authorized positions. As of January of this year, it had 910 vacancies, which is a vacancy rate of about 15.2%. 25% of the total current vacancies have been unfilled for more than a year, and 47% were vacated in the last 6 months. Exhibit 4 shows the number of filled positions and the number of vacant positions as of January 1st of each of the last 10 fiscal years. So you can see that the number of filled positions has been decreasing while the number of vacant positions has been increasing during this time. And then the line on this chart, which is either red or dark gray, has been declining since fiscal 2015. That's representing the percentage of positions filled. So each of the units at DHS has been experiencing high vacancies, but Social Services Administration has seen the highest number. About half of the total vacancies department-wide are in the Social Services Administration. And the local departments of social services are also experiencing extremely high vacancy rates and have the highest number of authorized positions, so it has a much larger impact. On page 12 begins a discussion of the local departments of social services vacancies. This is also where most of DHS's public-facing positions are living. Exhibit 5 shows 4 programs that are administered by the local Department of Social Services, and the proportion of positions filled in each fiscal 21, fiscal 22, and fiscal 23. You can see that the general trend is that the number of filled, or the percentage of filled positions rather, has been declining. The Family Investment Administration did see a slight increase between fiscal 22 and 23, and Child Support Administration as well to a lesser degree. But generally the trend is declining. To understand how long these positions are remaining vacant, we can turn to page 13. Exhibit 6 shows the vacancy duration by the same 4 programs that we just looked at on the prior page. This breaks out vacancies by the proportion that have been vacant 0 to 6 months, which is represented in yellow, 7 to 12 months, represented in orange, and then the percentage of positions that have been vacant for a year or more in red. Further down on page 13 begins the discussion of the efforts DHS has taken to address this issue. The 2022 Joint Chairman's Report requested a response from DHS outlining what steps it's taking to increase recruitment and retention. And DHS cited several barriers that it's been experiencing, including low employment rates across the nation, issues being able to offer competitive compensation, the degree to which DHS is able to offer flexible work environments, and the degree to which that they're able to offer sufficient professional development opportunities and growth opportunities for existing employees. On the following page, also lists out some of the strategies DHS has employed so far. The first is to adjust the minimum education and experience requirements for various positions to expand the potential candidate pool. The second is to streamline the recruitment process, cut down on some of the steps to make it a little speedier. They've also employed the expertise of a marketing consultant to increase DHS's visibility as a potential employer. They've taken steps to make salary adjustments in order to offer more competitive compensation. And then DHS has also been working internally to engender more flexible and supportive work environments. On the following page, at the top, there's a brief discussion of vacancy savings. Because they're experiencing higher amount of vacancies than budgeted, there's a bit of a surplus in the fiscal 23 appropriation. And so DHS included in the 24 allowance $10.5 million in salary adjustments to increase those salary levels. And so based on this figure, DLS estimated that it would cost about $6.6 million to make salary adjustments for the fiscal 23 year. Based on that, we also estimated that there would be about $16.8 million remaining in general fund surplus for the fiscal 23 appropriation. And as such, DLS is asking DHS to comment on how they're going to use that additional savings. The bottom of page 15 is a discussion of the utilization of contractual FTEs, which can be used for short-term urgent needs. DHS employed 280 contractual FTEs across the entire department in fiscal 22 and 23, and 188 of these positions were created using funding from the American Rescue Plan Act. That funding expires at the end of federal fiscal 23, so the end of September of this year, and DHS plans to convert as many of the contractual FTEs into regular employees as possible. The next page, Exhibit 7, demonstrates essentially just that the average tenure of regular employees is always greater than the average tenure of contractual FTEs, again underlining that contractual FTEs are really leveraged for urgent acute needs. So quickly, I'm going to go through the second issue that I wanted to bring up to the committee, which is related to the MD Think platform. So again, MD Think is Total Human Services Integration Network, and it's meant to house multiple data systems across DHS as well as other agencies statewide to improve interoperability, increase efficiency for users. The MD Think program concluded its setup phase in fiscal 23 and is moving on to the management and operation phase in fiscal 24. The fiscal 24 allowance includes $135 million for maintenance and operation of this system. And Exhibit 8 on page 17 shows a timeline of when the DHS legacy IT systems had been decommissioned and transitioned over to the MD Think platform. So I'm going to conclude my presentation with the 3 recommendations DLS is making to the committee, starting on page 19. The first is to restrict $100,000 of the general fund appropriation pending a report on DHS administration's efforts to improve oversight of the local departments of social services. This is a result of repeat audit findings for an audit that was released March of 2022. There were 5 repeat findings out of the 6 that the audit presented, and so the Joint Audit and Evaluation Committee has requested that we restrict funding. The second recommendation is to adopt committee narrative on a recruitment and retention strategy update. And then the final recommendation is to adopt committee narrative on external utilization of the MD Think platform to understand what other state agencies might be able to also be a part of that project. The rest of the report also has standard appendices covering JCR responses, audit findings, and then an update on the MD Think project. But I'm done with my presentation. Thank you.
Wonderful. Any questions for the analyst? Delegate Henson.
Will that affect salary offerings, or does that only impact existing employees?
Okay. I think that DHS can speak probably a bit more in detail about this, but my understanding that it's impacting both. So it's both to raise up the base level salaries for certain positions, again, prioritizing those public-facing roles, and then as well as including retention bonuses for existing employees.
Thank you. And then I had a second question about the practice of salary offerings that were above base and how that was impacting existing employees, but I do have a bill that's being called for hearing in another committee, so I apologize, Mr. Chair, and apologize.
Not a problem. You can follow up with the analyst later if you'd like.
Thank you.
And I actually have a quick question as well. If you go to the Where It Goes chart on page 8 at the bottom for IT projects, we are seeing M&O budget for MD Think in the 5.3 and 3.3-ish million each, but there's also a additional 15 million budgeted for Amazon Web Services for external agencies. Amazon Web Services, I believe, is the prime contractor for MD Think as well. So can you distinguish what that other 15 million is?
I'm going to defer to DHS for more detail, but my understanding is that Amazon Web Services is just the web hosting and that they were experiencing cost increases. And so that accounts for the 15 million, whereas the other maintenance and operations costs are more for, I guess, the general operations of the system, not including what's going toward Amazon.
We're paying 15 million a year for web hosting? I'll ask the department.
So.
All right, sounds good. Thank you so much. Okay, thank you. So with that, I'd like to bring up the Acting Secretary, Rafael Lopez, and your team, which they are not, as I mentioned earlier, they are no longer listing for me, so please bring up whomever you like. And please begin whenever you get the chance.
Good afternoon, everybody. Chairman Resnick and honorable members of the committee, I'm honored to be here with you. My name is Rafael Lopez, and I am serving as the Acting Secretary of the Department of Human Services. For those of you who've heard parts of this, it'll be a little bit of a repeat, but not the whole thing, so I beg your forgiveness. Thank you for the opportunity to discuss with you our department's administration budget for fiscal year 2024. Joining me at the table are, to my right, are Daniel Waite, Acting Deputy Secretary of Administration, and to my left, Stafford Chipungu, our Chief Financial Officer. In addition, I'm joined by, behind me, a series of senior leaders in the department to answer your specific questions. I will say right off the bat that I've shared with all the senior leaders from the first day I walked into the role that I cannot speak to decisions that were made prior to my arrival, but I'm happy to speak to the vision and the way in which we're going to lead moving forward, and happy to make those distinctions for you this afternoon. So behind me are Lashira Ayala, the Executive Director of the Family Investment Administration, Denise Conway, Executive Director of the Social Services Administration, Kevin Geistwhite, Executive Director of the Child Support Administration, Patrick O'Malley, DHS Chief Portfolio Officer for MD Think, Marva Sutherland, Inspector General for DHS, Denise Wheeler, Director for Citizen Review Board for Children, Courtney Thomas Winterberg, Director of Allegheny County Department of Social Services, and Tiffany Rexroad, Director of Washington County's Department of Social Services. On those two partners in particular, for Courtney and Tiffany, one of the things I did the very first day in office was to ensure that I reached out to and set the tone of partnership with all 24 jurisdictions, rebuilding the relationship, reimagining the way in which we should be working together across the state of Maryland. And I'm honored to have them both here, and a series of directors from across the state for each of our budget hearings to answer your questions. We're also here to dive into a variety of pieces of work that I've inherited, as you all have been talking about with the questions you've asked. So we're happy to dive in and actually give you a sample of some of the very quick and early thinking to remedy some of these issues. I'd like to also take a moment to thank Naomi Komuro. Though I haven't met you personally in person, I hear great things about you, and we are thankful for your analysis and help with the budget. All of you have received my written testimony, so I'll not repeat that here. But I want to take a few minutes to at least set the tone around the way in which I hope to lead should the Senate confirm me as your Secretary of Department of Human Services. So top of mind for me as a member of this team, the newest member, are over 1 million Marylanders who we have the honor of serving every single year. Should I be confirmed as the Secretary, you will have in me an authentic partner who will work with you every single day to generate solutions and deliver better results for some of our toughest challenges facing the people of Maryland. Together, we will be relentless in the pursuit of excellence as we make sure that the people we serve receive the help they need when they need it. Together, we must model with our actions and not just our words that the people who come to us for help are already full of beauty, grace, intelligence, and promise. And when they come to us for help, that we don't respond to them in judgment, but in fact make sure that we are engaging them in the most respectful and dignified way, whether they come into our offices, whether they phone us, whether they email us, or if we see them on the street. They should walk away knowing and feeling that they were treated with kindness, respect, and dignity. The people of Maryland deserve nothing less. Now I'd like to walk us through taking a look at the responses that we have both prepared in writing and also want to give you, again, a window into some of our early thinking. First, we concur with the 3 recommended actions. So those are a non-brainer in my opinion. And next, we're going to turn over to the 4 issues, and I'm going to walk you through each one. And then if you have further questions, I'll call upon my colleagues who helped formulate those responses and decisions over the course of the last year prior to my arrival. So issue number 1 on page 5 specifically addresses the need for the department to continue improving its timeliness on a variety of factors for the Citizen Review Board for Children. Ultimately, the team is being asked to use additional supervisory tools and to track data in terms of enhanced performance and to use that data to drive strategy moving forward. We will continue to add staff to vacancies, and the team is also reviewing options for a system that's more automated in terms of basic reports. Similarly, specific efforts will include the use of a checklist for staff with all post-review processes, including recommendation report due dates, and supervisory biweekly production and review recommendations on timely reports. None of these issues that I've just raised are rocket science recommendations, but they need to be tracked, they need to be accountable, and make sure that we report both to the department leadership and to you as a legislature. I'll move on to issue number 2, which is on page 15. Specifically, you're asking us to address what might our plan be around additional savings, as our analysts spoke of, and we have sort of 4 main buckets that we're currently thinking about in that space. Number 1, we would plan for covering any potential deficits during the fiscal 2023 closing. We hope to not have those, but given the recovery from the pandemic, we need to be thoughtful about sort of ways and changes with the number of people who are asking for help. Number 2, we want to add to the TANF balance statewide. Number 3, we are deliberate in trying to be thoughtful about how we're going to reimburse DHS clients whose cash assistance benefits were stolen by either card swipe fraud or some other way. And I want to speak to that. I'm sure you have some questions about that, both in terms of the federal partnership that we're pursuing and what will take a whole of government of Maryland response to engage our people in a very dramatically different way than the way we have historically. Finally, in the 4th bucket, We want to increase resources to recruit and retain staff. To put it mildly and simply, the way in which we've been recruiting does not work. And that's not a judgment on any one person or any administration. We have to think wildly and radically different about the way in which we are engaging people because we have jobs that could be filled, and we'll also give you an example of that. I want to skip to issue 4 first and then come back to 3. Issue 4 specifically asks us to talk about the issue related to transitioning other IT systems to Maryland Think, and we concur with that recommendation. We already, in this new administration, have met once as a sub-cabinet with all of my colleague acting secretaries. Many of us have taken extensive meetings with the MD Think team. I've met with the entire senior leadership of MD Think and have set the tone that while we and I am deeply grateful for the visionary creation of and the investment of both resources and time, it is time to write the new chapter of MD Think around making sure all these systems are working together across departments and that most importantly, they serve the people in whose names we do this work, so it's easy for them. And now I'm going to go back to issue number 3, which specifically is talking about the issue of recruitment efforts. And as we prepared for these hearings, we thought to ourselves, it's really easy to say that we concur with your recommendations, which we do, but it would also be helpful as legislators to have an idea of some of the ways we're thinking about it just in the last couple of weeks, because it means doing our work wildly different. And so I'm going to turn it over to Acting Deputy Secretary Dan Waite to walk you through some of those ideas, and then I want to ground it in 2 specific examples of how we might actualize those ideas in the next couple of weeks. Dan.
Thank you, Mr. Acting Secretary. Mr. Chairman, Mr. Vice Chairman, members of the committee, my name is Daniel Waite. I am Acting Deputy Secretary for Administration at the Department of Human Services. In addition to that, wearing another hat, I am Director of HR for the Department of Human Services. I am hoping that you all got a presentation that we sent you yesterday evening that I want to walk through very quickly for you to talk about what we are doing at the department to address certainly what we see as one of the most critical issues within state government in general, not just within the Department of Human Services. I want to start by sort of giving context as to largely why we're here today in terms of where state recruitment and retention is. There are certainly large-scale systemic challenges that we face as a state in recruiting and retaining staff. But in order to give the full context of where we are, we cannot fail to acknowledge the hiring freeze that happened during the COVID pandemic. This is not an effort to Monday morning quarterback. There were certainly decisions made at that time that had to be made at the time, but it's a reality. During and in the graph that is on page 2 of the slide deck that we sent, you can see that from March 20th, 2020, where we had almost near record low vacancy rates, our vacancy rates increased by 8% in a year and a half and are now near 15%. We came out of that hiring freeze into a really interesting new paradigm of a labor market. We've all heard of the Great Resignation and the challenges of really new focus that workers have since the pandemic. So we're at a place right now where historically we would be plus or minus 1.5% over our required holdback, which was usually somewhere around 7%. To a restabilization in that 1.5% plus or minus range, but we're restabilizing at 15% vacancy rate, which is certainly unsustainable and is problematic. So we definitely want to acknowledge that. So in my role as HR director and in our role as leaders, we're often asked, what keeps you up at night? And the thing that keeps me up at night is the worry that we are in a negative reinforcement cycle in our HR staffing issues. That negative reinforcement cycle is people leave, workloads go up, causing people to leave, causing workloads to go up. So the obvious question in that, to that concern is, how do we break that cycle? So over the last year, we have been really focused on restabilization, which, again, from the data, we've largely done. But now we have to plan for how do we now grow. So that is the genesis of our break the cycle plan, our recruitment and retention plan. So our plan has a number of components. The first component is removing barriers to entry, especially in our entry-level positions. Not only is this a solution to part of the problem, it's the right thing to do. And we recognize as we looked at this problem that those barriers to entry, specifically requiring college degrees for the work that we do, disproportionately impact underserved communities. The very people that we're trying to help, we're trying to serve, we can't give jobs to. So in our Family Investment Administration, we changed the job spec to remove the college degree requirement, to require a high school degree and 6 months of pretty much any type of work experience qualify for that job. We had an enormous success, which you'll see later in the presentation. So in December of 2022, we changed the job spec in our child support specialist series to mirror those changes that we had made in family investment. Coming soon, we are working on developing a high school internship program that will focus on individuals who either do not want to go to college or feel that they don't have access to a college education so that they can begin to see the opportunities that we have to offer within the department. The next piece of our plan is streamlining recruitment processes, taking the bureaucracy out of the bureaucracy. So to start with, we have removed the need to get a bunch of paperwork done to start recruiting. So essentially, as soon as somebody turns in their notice that they're leaving, they can start recruiting for that position. They can post it, they can get lists pulled, they can move forward with that. Next, and I think sort of innovatively for our department, we have started recruiting across classifications. So what that means is if we are posting for family investment specialist and we do a large-scale interview process and we have 5 people that come out of that, but we only have 3 vacancies, but we have vacancies in our child support area, we can hire those people into child support rather than into family investment. And we are now expanding that to actually recruit across job postings, not just in the actual room, so to speak. In addition to that, we are being more flexible in specialized needs to reopen lists. And a great example of that was in Kent County. We were informed by our local Department of Social Services that a factory was closing. We reopened our list at their request. We hired 5 people who otherwise would have been out of work because of that factory closing. Our next step is marketing the department as an employer of choice, not as an employer of last resort. We are, and one of the things that Acting Secretary Lopez and I have had deep conversations about in the last couple of weeks is a multi-channeled social media approach to getting out there to where the workers are to let them know we have positions available and we're ready to hire. In addition to that, we're making direct contact with universities in the state and high schools in the state, again, to show the opportunities we have available. We recently employed, and I do want to make one quick correction to the analyst's otherwise fantastic report. Our marketing person for recruitment is a state employee, works in our HR unit, is not a consultant. So that's a permanent situation for us. In addition to that, we engage our local departments of social services as a partner to give us feedback on what they need at their level as the boots on the ground folks. In fact, yesterday we had a meeting where all the local directors were there and the topic of recruitment and retention took up about 75% of a 3-hour meeting. Finally, we're looking at ways to build clear career paths for folks so that they come into the department and they have an opportunity to stay with us over the long term. The next pillar of our plan is to build work environments that are focused on balancing departmental needs with employee well-being. We learned a great lesson during COVID that I'm glad we are not squandering, which is balanced correctly to ensure that our clients' needs are being met. We can be successful in a telework environment. And to that end, approximately 70% of our employees have access to telework at least one day a week, which has been staff report back. That's one of their favorite things that has happened over the last couple of years. We're improving our employee engagement feedback systems, which included starting in August of 2022 with a comprehensive employee experience survey. We built a centralized exit interview database, and our learning office has developed and is re-engaging in a robust curriculum of employee development trainings, most of which offer CEUs to our social workers. And finally, we're focused on continued focus on pay equity and competitive salary. And it's already been mentioned that we pursued increase in steps for our frontline public-facing workers. That includes our workers in family investment, child support, and our services group. And the result of that is that as of November 15th, 2022, our family investment child support workers start with a high school degree at $43,000 a year. Our social workers start at $70,000. Our social work supervisors start at almost $90,000. We believe that these competitive salaries are going to drive results in bringing in those hard to recruit classifications. So what has been the results of our efforts? Year over year, so February 8th, 2022 to February 8th, 2023, we filled 1,258 positions. Now, that is balanced by folks leaving as well, and we did have 1,232 folks leave for a net positive of 26 positions. Now, if you compare that to year-over-year data for the last non-COVID year, 2019, we recruited almost 250 less people. We had a similar ratio of separations, but we ended up net negative 4 positions in that year. So we feel that there is improvement there. But most importantly, and I'm going to conclude here because I know I've taken a lot of time for the committee, what we are seeing, and it tracks well with our changes in compensation, is that our turnover rate in the last 6 months has gone down significantly. We started in August at a turnover rate of 1.67% monthly. In January, our turnover rate was 0.83%. So we now with that 0.83%, that's an annual turnover rate of approximately 9.5%. If I do a lot of reading, a lot of research, healthy organizations generally have turnover rates somewhere between 10 and 12%. So if we sustain that 9.5% rate, we will be happy with that as long as we are bringing in folks at a much higher rate. So with that, I will conclude my presentation and turn things back over to Acting Deputy Secretary Lopez. Thank you.
So to put a fine point on this, as I was diving into the job descriptions that Dan and others have shared with me, wondering what the data looks like, the saying of, how does one define insanity? It's doing the same thing over and over again, expecting a different result, right? And so that's why we have to change the way we're doing this work. So to give you one concrete example of the kinds of infrastructure we're going to have to build, because it's not what's existing right now at DHS, is that as of February 6th, we have 4,054 kids in foster care, for example. Of those 4,054 children, 24% are between the ages of 16 and 20 years old, or 719 kids, young adults. Why wouldn't we be looking at looking to our own young people who have great promise and potential and asking ourselves, how might we support them in helping work for the department? How might we encourage their friends and others? Similarly, how might we imagine using tools that have not been used before at the department to recruit the very people from a variety of age groups and a variety of backgrounds, whether it's through Instagram or other ways of engagement? So bottom line, what we're saying to you as a legislature is that we need to dramatically transform how we recruit. So we anticipate rapidly prototyping these ideas, and that ties to our audit findings. I have, in my 2 weeks here, gone through all of the audits that have been named by the department. Marva and her team have been spectacular in walking me through them. I've actually read them, and there is actually a theme that I've shared with the senior team, which is that there are some repeat findings. My personal perspective from my own career is that I don't like repeat findings because they signal a systemic problem in whatever department you're in. And so while there may be reasons for those, I said very clearly to the senior team, we will come back to the legislature, we will articulate a plan, and we'll say why there are repeats or work with our auditors to make sure that we don't have them again year after year after year. That said, the department has corrected audit finding number 2 that you asked us to comment on. For the remaining 4 findings, we will move forward with a comprehensive corrective action plan and make sure that reporting up to you our progress over time. And if we struggle, we'll tell you what that struggle is and come back to you with the plan for correcting that struggle. Again, as I've shared with our senior leadership in the context of reviewing all of our audits and preparing for budget hearings, we must move away from a pattern of repeated findings. I can assure you that the department will work diligently to correct these findings. And with that said, that concludes our testimony, and I'm prepared to answer any of your questions.
Thank you. Delegate Henson.
Thank you, Mr. Chairman, and I personally want to thank you for taking your time and walking through that testimony. I want to pick up where I left off. Wanted to understand the impact of the raises. One of the things that we've heard from current employees is that when folks are hired at a salary that's above base, that it brings morale down when people see that happening. Are the raises being distributed in a way that existing employees will have their salaries elevated to be competitive with the new offerings?
Thank you. I was hoping to get back to that question. First of all, when we changed our hiring base, which I think was an earlier question that you had in November, we then brought up all of our staff in those same classifications to that minimum hiring base. So anybody who was below that hiring base, we brought their salary up. With respect to hiring above base, yes, in many cases, there are 2 buckets of hiring above base. There are hiring above base specifically for recruitment difficulties, and then there's hiring above base because the candidate has certain specific extraordinary qualifications. And although we understand the tension that in some cases exists when we hire above base for those folks with the extraordinary qualifications, we don't, in many cases, then raise up everybody else's salary because they don't have those same qualifications. That said, in the situations where we are offering above base in a situation that is specifically around recruitment difficulty, there are actually provisions in the MOU right now which require that we bring up the other staff within the same unit to that salary. I hope that answers your question.
It does, and that's good to hear that the work of trying to create parity there is being started. My only word of caution when you're evaluating extraordinary qualifications, we passed a bill in the General Assembly that said that people would not be required to disclose their prior salary history and that salary history be used as a way to determine salary offerings. The problem is that we know that typically discrimination exists in the employment market. And if a person is started off with a lower salary, it has the impact of really locking them in at a lower salary when they're going out to a new position and they can't kind of escape that history. So I hope that in the extraordinary qualifications that we are also looking at ways to make sure that's administered with equity.
Absolutely.
If I may, another, Mr. Chairman. The position of now lowering the barrier to entry to be able to access some of the positions within DHS. Are you looking at the kind of flip side of that and making sure that the managers, the mid-level supervisors, that perhaps you are asking more of those positions so that the appropriate mentoring and support is there for folks who may be right out of high school? For instance, the Department of Child Support Enforcement. There are fiscal audits that are performed on an obligor's account, and those fiscal audits are not performed by CPAs or an outside firm. They're performed in-house by some of these positions that we have now lowered some of these barriers to entry on. And it has a person can be incarcerated for not paying their child support. And we look at those back balances, and that's how those determinations are made. So are we doing anything on the flip side of kind of lowering that bar to make sure that the support that they have if they are hired is really top level?
Yes, your question raises a lot of answers, and we could talk for hours on it. But the simple answer is yes. We have been engaged in numerous conversations, activated a number of plans to ensure that our training is appropriate given the changes that we are making. We understand that not all 18-year-olds are prepared to jump right into the work. So not only is there training for the supervisors on how to respond to those folks, but there are also discussions around how do we prepare, or how do we increase the skill set of those folks. But I also remind everybody that slightly more than 30% of Americans get college degrees. So we often talk about this issue in terms of that 18-year-old. But for those jobs that may require a more extensive skill set, I say go out and hire the 35-year-old that only has a high school degree, but has extensive life experience that prepared them to do that job. With the change in the spec, we now open the door to those folks as well as those people coming directly out of high school.
Can I take an additional take on this, Madam Delegate? And I think it's worth offering sort of a personal example. I was a JTPA kid when I was a teenager. And what that meant was the Job Training Partnership Act provided low-income children with the ability to actually get a job. And so all of my high school years through the summer, in addition to everything else I did on the weekends and in the evenings, I was a teacher's aide in a migrant summer school. And I also served as a teacher's aide for children with special needs and disabilities. I would not have gotten that job had I not come from a low-income family. But for the teachers and the mentors and the coaches who helped groom me, I wouldn't be sitting here before you today. And so what I'd like to expand our collective thinking about is that in a world that has dramatically changed in terms of our educational requirements, in terms of a post-pandemic, we have to think very differently about how we are creating these systems. To be uber transparent with you, probably no surprise to you since I'm the newbie here, that many of the structures that Dan is talking about are either new or going to be done. And so these are things that we are desperately trying. That's what I've understood from the staff, but we'll only be able to rapidly prototype them and test them to come back here a year from now and say, these things worked, let's scale them. These things did not, let's get rid of them, and not continue to work on things that just waste time and money. And so with that said, we have to think differently about how we train up our existing workforce to provide them opportunities to thrive as well, and make sure that we have things like academies. Yesterday in that conversation with the 24 jurisdictions, all directors made it crystal clear to me that the way in which we are engaging our people in training is not sufficient right now. We have to do much more of that. So it's a both and approach. I wish I had a magic wand to make it move quicker. We don't, but we are going to dive in head first in the next couple of weeks, and for this first quarter, test out these ideas and try to yield greater results than the 26 net result that we've already come up with in the last year. It's worth changing.
Sure. And of course, we want to be your partners and making
Absolutely.
sure that you're thinking innovatively and creatively on how to resolve these challenges. You're absolutely right that we can't continue to do the same thing and expect different results.
That's right.
But when implementing those things, if you can issue spot for areas where you may need to take a deeper dive in terms of what's the net benefit going to be.
Right.
If we require more of our supervisors and managers because of the changes that we've made, then it really is just burden shifting.
Understood.
So I just want to make sure that as we look at that, we are supporting our supervisors and managers, and also, to your point, making sure that the talent that we're getting is not just talent that is able to meet these new revised standards, but also people who have experience in other ways that supplement, that could really make them real value adds. My final question is on the analysis report, page 11. It stated that nearly half, the 47% of the vacant positions were vacated in the last 6 months. Can you give me any additional insight into that?
So it is, in essence, that negative reinforcement cycle that I talked about. The thing that keeps me up at night, I believe, is the main driver of some of those results. I mean, it is not, we can tout our success at bringing in, 1,250 folks over the last year, but we also have to take our lumps and our responsibility for the fact that 1,230 folks left in the last year. Again, that's not sustainable. That equilibrium does not ultimately serve the needs of the department. So we have to find ways, and we've begun this discussion, to process re-engineer in ways that if we are going to be in this post-COVID labor market, and it is going to be a continued challenge to bring talent into the department, how do we make sure that the talent we're bringing in are being used most effectively to do what they're required to do? And a great example of that is with our social workers. There are statutory things that social workers need to do. And we should be having them be able to focus on those things and taking administrative burdens off of them in situations where we can do that. That will then enhance the job experience of the social worker, who is really, in most cases, called to that type of work, while at the same time allowing us to build skill sets in other workers and move them up, because there are other opportunities to perform these support administrative duties. It potentially, and this is something that we're talking about right now to Acting Secretary Lopez's point, is how do we do that? How do we do that effectively? And how do we make sure that that enhances career paths so that we don't have that continuous negative feedback cycle going on? Does that make sense?
I don't want to infer anything from your answer, so I just want to make sure that I'm receiving clearly what it is that you're saying. Is this your normal attrition rate or something different?
So again, if you look at the charts at the very beginning, the historical vacancy charts, where we generally lived in a neighborhood of plus or minus 1.5% over our required holdback, this is consistent with that cycle. And again, we have to do things differently so that we break out of those equilibriums and we show growth. One of the things that I'm very committed to, one of my mantras to my HR team is, 2020, 2021 were the year of increased vacancy rate. 2022 is the year of stability. 2023 is the year of growth. And I hope that when we're back here next year, we are not only touting the number of positions we filled, but we're touting the number of positions that stayed.
So if I'm understanding correctly, half of the vacancies are long-term and half of them would be these rolling vacancies where you are experiencing that turnover month over month. Am I understanding that right?
Yes, but remember the turnover rate that we talked about, that's really what that's a reflection of. So if each month we are, we're an agency of 5,000 folks, so if each month we are losing 1% of our staff, I don't do math, that's 50 people a month that we're losing. So that then plays into, generally, and we're working on making this better, generally it takes 3 to 6 months to hire somebody into a state vacancy. So that would generally then account for the reason why those vacancies are in that range.
Well, I thank you for that insight, because that does sound like something we can work together on. If
Absolutely.
The hiring processes are moving at a pace that's creating this lag, then that does sound like room to work together. Thank you, and thank you for the indulgence, Mr. Chair.
No problem. Thank you. Any other questions? Delegate Shetty.
Thank you, Mr. Chairman. Thank you for joining us today for this in-depth overview of your budget. Truthfully, I'm really inspired by your vision and really excited to partner with you to make sure that those who are low income here in the state are receiving the support that they need to stabilize and thrive. And I grew up in poverty, and I have a strong interest in working with you all on these issues. I'm especially interested in looking at ways that we can partner either through regulation or legislation or both on making sure that we're not exacerbating poverty by withholding child support payments in an effort to reimburse the state for benefits that families need temporarily while they're stabilizing. So we could talk a little bit about it now, but if I would actually prefer a longer chat offline so that we can work together on that effort.
Sure. Madam Delegate, we already have that in common in terms of our backgrounds. What I will say to you is actually a conversation I had with Kevin Geiswhite, who's our Executive Director of Child Support. And as I'm getting to know all of these leaders, I'm trying to make clear both my philosophy and the way in which we want to move forward. And I said to Kevin, the work of child support has been siloed, not just in our department, but across the country. Yes. That is part of child welfare. When we were able to make families whole and to support them and not get in their way to thrive, then we are much more robust. And so people don't live in departments and divisions. They live in families and communities. It's our job to figure out how to make it easier, not theirs to navigate us. So that's going to take some work, and I'm happy to schedule a time to talk with you in more detail about your interests.
Thank you very much.
Certainly.
Any other questions? So I have a few, but before I do, I want to thank you first. I know you said in the beginning that you did not want to look backwards, and I agree with you, but I do want to comment that I've chaired this subcommittee now for 8 sessions. So for nearly a decade, once a year, I have asked the question, what are we doing to fill vacancies? And for the first time in 8 years, that was a legitimate answer. So thank you. That
Amen.
was a comprehensive answer, and we actually are walking out of here with an understanding of what this department is going to be doing to fill vacancies. So yay for first times. All right. I do have a question, and it might retread a little bit about what Delegate Henson was asking about with regard to training. Clearly, there is education and experience that is limited to any 18-year-old. Anyone who graduates from high school and works 6 months at any job is not going to be prepared for many jobs. And in the case of the work of your department, financial matters were raised. When I was 18, I could not manage other people's money, much less my own. But also, the issue of casework is not so much a science as it is an art, and it takes experience and time. So I wanted to talk a little bit about training and opportunities and what you're thinking in a little more detail.
Certainly.
I'd like to know a little bit about what you're doing with regard to internal training, not just for managers mentoring, but actual hands-on training, and any opportunities that you are thinking about in offering some of these new hires in terms of higher education. So if you hire somebody on as a caseworker, as a program manager, whatever it may be, but really what you need are social workers, and you can't train out of that. That requires a bachelor's. You know, the opportunities that you will then present to some of your staff that while they are working, they may be able to get additional certifications or degrees. The second part of the training question is unrelated to that, and it specifically deals with MD Think. When I speak to line employees who have worked regularly, have had to work regularly with MD Think in its various stages, the biggest complaint that I have, other than it didn't work when I needed it to, which I'm hoping you fix, is nobody really trained us to use the system. And so what are we doing for training department-wide to make sure that your staff is prepared to use the system that has now cost us nearly $700 million to build?
Understood. Dan, I'm going to answer question number 2 first, set the tone for 1, and if you could specifically address what's been done prior to my arrival.
Yes.
So on MD Think, Patrick O'Malley's here, our Chief Portfolio Officer, and I will give you a concrete example of yesterday's meeting with MASD, the Maryland Association of Social Services Directors. Every day since I've landed in the role as acting, I've heard a variety of concerns, not all negative, but a variety, and there's been some consistency in what I've heard. I went straight to Maryland Think and said, the only way we'll be able to course correct is to be transparent with each other and to start this new chapter. That's also around change management. The people who need those systems to work every day, our employees, need them to work flawlessly and seamlessly. And we're just barely launching many of those applications. So the way in which we take what's not working well and rapidly prototype new solutions, that's where things stand as of today. Number 2, as a result of that MASD conversation yesterday, and I listened to all 24 of my colleague leaders, I have to and we have to invest in their leadership and their capability and their authenticity in what they're experiencing amongst the 24 jurisdictions. And with that said, on the moment, I said, it sounds like we need a moment to have a retreat with all of the directors who are going to bring a team of people up and down the chain to then engage with Maryland Think and walk out of that day-long retreat to have very clear guidelines, accountability, and timelines to make sure that we are course-correcting these things. All that rests on investing in our staff to make sure they understand what these things are. Concrete example, over the course of the last couple of weeks, I've asked for a number of data sets as I'm responding, whether it's to major issues or lawsuits or others, and how I should be able to extract information should be at my fingertips, the way it should be at other staff. We're barely going to get there. That's not a bad thing. It's part of the genesis of development, but it's what we should expect. So the floor should be of excellence so that we can move forward with continuous quality improvement, continuous learning for adults. And the way in which adults learn who have years of experience is very different than the way in which a young person learns, who's in elementary school or middle school. So making sure that the way in which we are robustly responding to these things is what we need to do next. So that's on the MD Think side. That retreat's going to come up. We just did a survey yesterday, probably in late February, early March. And the point is to model that we're not afraid to tackle the tough challenges that you are lifting up. We are not afraid to make sure that we can scale the things that are working well and stop the things that are not. That's all right. That's what people deserve. On the issue of training writ large, again, I'll have Dan speak to what's already been done. I'm not as familiar with that. What I would say to you is that in talking with Dan and other senior leaders, we've been talking about things like talent pipelines. How do you create opportunities for people at multiple levels of their development and their careers so that perhaps the 18-year-old you reference might start as a entry-level employee making $36,000, $37,000 a year, which is what that job pays, may not have all the skill sets, but is inspired by their colleague or mentor who is a social worker and maybe a senior social worker. The bridge between making $36,000 a year and $90,000 is not a short one. You have to be able to train up with those right skills. So we want to make sure you all understand that we're not saying that the person who is 18 in that entry-level job is going to have the complex work day one of a well-trained master's level social worker. We have to respect their education and their ability to invest in their careers. But we can create these talent pipelines in a very different way and amend our recruiting strategies. Final point I'd like to make there is one that I recently did in my federal government role, which is working with responding to the largest surge in American history of unaccompanied children. There's only a certain number of 100 federal jobs whose singular job it is in the nation to authorize the reunification of children with their kin in America. They had never had a consistent national portfolio to train them on their jobs. So what did we do in the last year? We created the first ever, what's called the Federal Field Specialist Academy. Every single FFS in the country, regardless of where you lived or your years of tenure, had to go through that academy. We built it from the ground up in an agile way and had a 3-week rapid prototype cycle. So the subject matter experts weren't folks outside the system. They were the very people doing the work on the ground. And then we tested it and went live with it. Now we had, I'm no longer there, every single FFS who has very basic training regardless of their tenure. One can imagine those kinds of models here, that all of our people, for all the various specifications, that we are investing in them, in their growth and development, and that the state of Maryland, when they do well and perform, we can groom them into greater levels of education and compensate them and help them get through a bachelor's or a master's degree. Why wouldn't we do that? That's going to take a new approach to managing talent pipelines and investing in the people that we have. Dan, do you want to speak to the sort of immediacy of the issues that you've done before?
Yes, absolutely. So the Department of Human Services does have sort of a long history of training programs at various levels of success. But one of the things that was recognized in 2012 was we did need a more comprehensive approach to training. And there was a lot of work done on that issue. In 2017, we created our learning office. Dr. Michael Dorsey is in charge of that office. And a curriculum was built out. And that curriculum was moving forward. We actually had a tiered training setup curriculum where it was certain training at the entry level, training to support and build skills so people could move into supervisory level, training for supervisory level folks, and it all came up to a pyramid at the top, which is our learning development, or our leadership development initiative, which is a 9-month high-intensity leadership program that is, you get into it through a competitive process, a blind competitive process. And those things were in place for career development. In addition to that, each of the major programmatic areas have training units within them. The challenge that we have seen over the last couple of years, again, is the pivot from in-person training to virtual training, and how do you make that training just as effective today as the training we had prior to the pandemic. Dr. Dorsey is working diligently to overcome those issues. We just hired a group of people. So when you, not to get into the weeds too deeply, when you do a virtual training, you need a training producer who's running all the equipment and things like that, making sure the slide deck is moving, supporting the actual trainer. We just hired a group of those folks to support those efforts. But the other thing that we're doing with that is, moving back into ILT, in real life training, because we know that that touch point is the most effective way for adults to learn. Having interactive training, making sure that it is something that they're taking away from them that they can practice in the next 24 hours so that it will be effective. We are, again, starting the journey of rebuilding something that we had to build it better. And in terms of the specific programmatic training, we do have the executive directors here for the programs who could certainly give additional information on exactly what those mechanisms look like if you would like to hear from them.
I think we can take the time at some point in the near future to go over a more comprehensive look. We have a number of other people waiting for the next budget hearing, so we don't want to take a much longer time. But I'm going to do one last call for questions. Seeing none, I want to thank you all very much for coming down and for a very comprehensive review of this budget. So I appreciate it. Thank you so much.
Thank you.
There is no one signed up to. There's no one signed up to testify from the public on this budget, so we will move to the next budget, which is the Department of Housing and Community Development, and we'll bring up our analyst, Emily Haskell.
Thank you, Mr. Chairman. Again, my name is Emily Haskell, and I'll be presenting the operating budget analysis for the Department of Housing and Community Development, or DHCD. In the budget summary on page 1, you can see DHCD's fiscal 2024 allowance decreases by about 18.5% to about $480 million. Excluding COVID-19 relief programs, the allowance increases by about 3%, mostly due to a $10 million increase in federal funds for Section 8 project-based rental assistance. General funds decreased by $4.5 million, which is due to a decrease of $20 million in one-time funding in fiscal 2023 for Prince George's County Affordable Housing Programs, and that's partially offset by increases of $5 million to implement the Climate Solutions Act and $10 million for the Community Safety Works program, which was funded in the previous year with federal COVID relief funding. On page 4, Exhibit 1 shows all the department's sources and uses of funding for both the operating and capital budgets, as well as non-budgeted funds. In fiscal 2022, DHCD spent about $2.3 billion, with more than half of that coming from revenue bonds and mortgage-backed securities. Only about 9% of the department's spending comes from state funds. Programs that promote homeownership and the development of affordable rental housing each accounted for 38% of spending. Next, I want to talk about the Water Utility Assistance Program, which was funded in fiscal 2023 using funds from the American Rescue Plan totaling $20 million. That funding is expected to be one-time, and there's no funding in the allowance to continue it. The program will provide grants to utilities to pay down outstanding arrearages for households impacted by the pandemic. The program is distinct from the Department of Human Services Low-Income Household Water Assistance Program. While households apply directly to the DHS program, utilities will apply to the DHCD program for bulk relief. Initially, DHCD noted that DHCD and DHS would implement processes to prevent duplication of benefits between the two programs. However, the Water Utility Assistance Program application process is now being managed by DVM rather than by DHCD, and I've asked DHCD to comment on any updates to the original planned process for preventing duplication between the programs. Next, I'll turn to what's included in the fiscal 2024 allowance. Exhibit 3 on page 8 shows a breakdown of the funding in DHCD's operating budget. As you can see, rental services programs make up most of the budget at 60% or over 60%. This is driven by $260 million in rental subsidies under a contract with HUD to administer project-based rental assistance across the state. Funding for energy programs totals $52.2 million in the allowance, which represents an 18% increase. The increase comes from two sources: general funds to implement the Climate Solutions Now Act and federal funds from the Infrastructure Investment and Jobs Act. Under the Climate Solutions Act, DHCD is developing a grant program to reduce greenhouse gas emissions in affordable housing projects, and the program is expected to open for applications this July. Mandated funding of $5 million is included in DHCD's operating budget in fiscal 2024, while in fiscal 2023, funding of $3.75 million was restricted in the Rainy Day Fund in DHCD's capital budget and recently released by the governor. The allowance also includes 2 new positions to manage the program. Overall, DHCD will receive just under $46 million in federal funds for the Weatherization Assistance Program from the Infrastructure Investment and Jobs Act, which DHCD plans to spend across fiscal years 2023 to 2027. The budget includes a $2 million deficiency for fiscal 2023, as well as $6 million in fiscal 2024. The first issue in the analysis, beginning on page 15, relates to the Homeowner Assistance Fund, which was created through the American Rescue Plan to provide relief to homeowners at risk of displacement. Maryland received nearly $250 million for the program, all administered by DHCD. Exhibit 7 on page 15 shows how these funds have been appropriated across DHCD's operating and capital budgets. Although budgeted funding decreases quite a bit in the allowance, DHCD will continue to use the prior year's capital appropriations to disperse funds under the program, with anticipated expenditures of approximately $70 million in fiscal 2023 and $60 million in each of fiscal 2024 and 2025. The funding is available through September 2026. Exhibit 8 on page 16 shows how DHCD allocated the program funding as well as the expenditures as of January. Most of the funding is for grants and loans to prevent foreclosure. Overall, DHCD had expended or approved nearly $80 million, including about $58 million of household assistance to more than 4,200 households. Exhibit 9 on page 18 shows the status of foreclosures in Maryland. Per executive order, the Office of the Commissioner of Financial Regulation did not accept notices of intent to foreclose from April 2020 to June 2021. And federal actions also provided forbearance of up to 18 months and placed a moratorium on foreclosures for homeowners with federally backed mortgages through June 2021. Both notices of intent and notices of foreclosure have increased since those protections ended. The notices of intent are starting to approach pre-pandemic levels, while notices of foreclosure remain below. The next issue relates to the Emergency Rental Assistance Program, or ERAP, which is nearing the end of available funds. As you can see in Exhibit 10 on page 19, Maryland's ERAP funding totaled more than $750 million. It's split across 2 rounds, as well as between DHCD and direct allocations to the 8 largest local jurisdictions. The fiscal 2024 allowance only includes about $280,000 in administrative funds, as nearly all the funding for both rounds was appropriated in prior years. DHCD distributed most of its ERAP allocations to all 24 local jurisdictions, as shown in Exhibit 11 on page 21. DHCD retained some of the funding to administer directly, including $25.5 million for affordable housing development, as well as a little over $50 million to provide bulk relief through the Assisted Housing Relief Program to tenants in multifamily properties. Exhibit 12 on page 22 shows ERAP expenditures by grantee as of November 2022, with the top bar representing DHCD's portion of the funding. Overall, ERAP had provided assistance to more than 101,000 households as of November, with 75% of all funding expended. All ERAP funds are expected to be exhausted by March or April 2023. As of this month, only 6 local programs have fully open applications still, while 3 more were open on a limited basis, only to households at imminent risk of eviction. An estimated 100,000 Maryland households remain behind on rent as of December, with estimated rental debt totaling nearly $375 million. Exhibit 13 on page 23 shows failure to pay rent cases and evictions over time, with data available through last September. Although still below pre-pandemic levels, evictions increased significantly during calendar 2022, with more than 4,100 households evicted in the third quarter, which is a 78% increase compared to the same period in the prior year. The third and final issue in the analysis is related to broadband, which, as you know, has seen its funding greatly expanded due to federal legislation. The state has allocated $400 million from the American Rescue Plan for broadband programs across the fiscal 2021 to 2023 budgets, which is shown in Exhibit 14 on page 25. This chart also includes about $35 million from other sources that were provided in prior years. In addition, DHCD is expected to receive at least $100 million from the Infrastructure Investment and Jobs Act for broadband, which has not yet been added to the budget. State allocations for this funding will be based on maps currently under development by the FCC and are expected to be announced in June. Most of the funding for broadband is provided through the capital budget and will be discussed in DHCD's capital budget analysis. And I'll focus today on the operating budget programs, which are shown in Exhibit 15 on page 26. All of these were newly created in fiscal 2022. The Maryland Emergency Broadband Benefit provides a subsidy for household broadband costs on top of the federal Affordable Connectivity Program. As of January, more than 50,000 Maryland households were enrolled in the program, and program funding totaling $45 million was provided in fiscal 2022 and is expected to last into fiscal 2025. The Connected Devices Program will provide devices to low-income households, and awards to local jurisdictions and community providers to distribute the devices are expected very soon. Exhibit 16 on page 28 shows the overall funding for broadband initiatives in the Infrastructure Investment and Jobs Act. The largest pot of money is for the Broadband Equity Access and Deployment Program, or BEAD, which has a $100 million minimum for each state and will primarily fund larger infrastructure projects. The next program is the State Digital Equity Capacity Grant, from which Maryland is expected to receive about $4.8 million annually. In December, DHCD received initial planning grants for these 2 programs, $5 million for BEAD and just under $1 million for the Digital Equity Program, for DHCD to develop a 5-year action plan and a digital equity plan. These planning efforts are underway, and DHCD hopes to have a statewide plan by this summer. Finally, page 30 shows the DLS recommendation, which is to adopt narrative related to DHCD's broadband initiatives, requesting that broadband programs and sub-programs be separately identified in DHCD's budget in order to enable improved tracking of the allocations and expenditures by specific purpose. With that, I'd be happy to answer any questions.
Thank you. Any questions for the analyst? Delegate Henson.
Thank you, Mr. Chairman, and thank you for the detailed report. I'm looking at pages 15 and 16, and I want to make sure I'm following the thread on page 15. It talks about the funding being split for the HAF program between fiscal 23 and 24. And then on 16, am I understanding that the total program budget for HAF is $190 million, and that what's encumbered of that so far is $52.7 million?
The total budget is about $250 million. The $190 million is just for specifically for the mortgage and housing assistance. And yes, I think the number you had on the amount that was expended so far, I think was correct. I'd have to look at the exact number.
And I apologize.
Oh, that's okay.
And that is for fiscal 23?
This funding is across all fiscal years so far. So the money was first appropriated in fiscal 2022 with additional funding in fiscal 23, and the some in the 24 allowance as well. But DHCD can continue to use the funds that were appropriated in prior years to fund assistance through the program.
I understand. So the goal to take some of the funding and kind of bank it more or less, and then to have it available for program funding in future years. This, because it looks like to me 57 million and the budget is 190 million. Is that an effective program? But am I hearing you say that the goal there is to kind of roll that over?
Yes, the funds are
Okay.
available through September 2026.
I understand. And then on page 22, you gave us some insight into how local jurisdictions may be dealing with the challenge of reaching that cliff with the funding that's there for rental assistance, and that some of them are using other sources from the ARPA funding. Do you know if there are other sources that could be dedicated to this purpose that might be available to us?
I'm not aware of anything beyond some of the ARPA funds that are still available, for example, the local fiscal recovery funds or the community development block grant funds, as well from the CARES Act. But those fund sources are not large, and they will not add much time onto the end of the ERAP funds.
Both the local fiscal and the CDBG, those are local funds. Am I understanding that right? The locals would have to make those determinations?
Yes, correct.
Okay, I appreciate it. Thank you. Thank you, Mr. Chair.
Thank you. Any other questions for the analyst? All right, seeing none, let's bring up the department. We have Acting Secretary Jake Day and your team.
Well, good afternoon.
Good afternoon. Welcome. And please begin whenever you're ready.
Thank you, Chair Resnick and Vice Chair Shetty, distinguished members of the committee. First of all, I want to say thank you for your time. This is my first hearing as Acting Secretary of the Department. I am joined today by Owen McAvoy to my left, our Deputy Secretary, and to my right, Robin Chaconas, the Chief Operating Officer of the Department, as well as many of the talented members of the team to my right. I want to thank first Ms. Haskell for the thorough analysis of our operating budget request, and to note just a couple of thoughts that I'd like to share. First of all, I'm incredibly thrilled at the opportunity to lead what I think is one of the best uses of the state's limited and the people's limited resources, which is to revitalize communities and to provide shelter, affordable, accessible, desirable, and safe shelter for all Marylanders. I believe that we use those limited resources effectively, efficiently, and we highly leverage those for great economic impact throughout the state with a comparatively low general fund impact. I want to note, as was shared by Ms. Haskell, we have an 18.5% reduction in our operating budget request from the fiscal year 23 appropriation. And also want to drill down on the 11% reduction in our general fund budget request in particular. Also think it's worth mentioning, and I don't know that this has been shared with you yet, but we currently have an 8% vacancy rate in the department, 27 vacant positions, and many of those are fairly senior positions that I'm actively working to fill. So I want to make sure that you know we're on top of that challenge. I realize there's going to be a lot of interest in our capital budget, and we'll be discussing that at another time. But on the operating budget, I want to respond to the two points that were noted. First, with respect to the Water Utility Assistance Program. First, I would just like to emphasize the importance of taking a holistic look at affordability, including the utility costs that are impacting every Maryland household. So this is an important program. We have significant experience. DHCD has significant experience at providing resources to local government. So working with local government utilities is something that we are fully capable of. Recognizing that there are two state agencies that have a bite at this apple, DBM and DHCD. I understand completely why ensuring that there is no waste, fraud, or abuse here and ensuring that all applicants are vetted fully is important. So DBM will be reviewing and approving applications while DHCD processes payments to these local utilities. We, like I said, have significant experience, particularly with ARPA, shepherding those dollars out to the local government applicants for the ARPA non-entitlement communities. DBM has planned to cross-check this program with DHS programs to avoid duplication, and the application, as currently written, has language that makes applicants attest to not double dipping in other programs that are provided. The second recommendation with respect to the broadband funds and ensuring that those funds are identified through a new program and a new structure and new code is one that DHCD agrees with. I want to also emphasize, just take the opportunity, if I may, to emphasize that infrastructure plus digital equity plus digital inclusion is a part of repairing communities that have been historically disincentivized that have historically been disinvested, this is part of 21st century infrastructure building and revitalization efforts. Connectivity is critical, and so agreeing with the recommendation, we will ensure that we work with the Department of Budget and Management on creating that new program structure moving forward. So I'm sure you've got questions, so I will pause my testimony there and happy to take any questions that you have.
Wonderful, thank you. So, Mr. Acting Secretary, before we go to committee questions, I want to point out we have 10 people signed up to testify and 32 pieces of written testimony, which I will tell you is a record for this budget. And I think a lot of them, just perusing, knowing who some of the testifiers are and seeing some of the written testimony, a lot of them are here because they are concerned about the end of ERAP and what will happen come March or April. And so if you could take a few minutes and address that particular point, I know everybody's very concerned about it. I think we would appreciate it.
I'm happy to, Mr. Chairman. First of all, I share their concerns. The Emergency Rental Assistance Program was a historic effort, not only by the department to shepherd the federal resources that came through, but a historic national effort to recognize what we all hope, I think, is a once-in-a-lifetime experience that affected every facet of society, including the ability for people to pay their rent and to pay their utility bills and to pay their mortgage payments. And so not responding to that is not an option. And over the coming weeks, I'm working closely with the governor's office to present ways in which we might respond to that cliff that we're staring down. And I say we, not only referring to we collectively as state government, but also the individual Maryland families that are staring at an individual cliff. Whether or not that the scale of that program needs to reflect the scale of money invested thus far, I think is the question. Having an emergency rental assistance program that acknowledges that some Maryland families will face crises of their own that are not related to a pandemic, I think is a worthy question, and one that we ought to work collectively together to find a set of resources to respond to. I don't think that needs to reflect the exact scale that we needed during a pandemic. So we've got to work together to identify and to design programs that respond to the for lack of a better term, baseline level of crisis that Maryland families will face moving forward. And I do think that once we identify that program for renters, continuation of a program like HALF is going to be important as well. There are, again, medical crises. There are other economic crises that face Maryland families every single year, whether we had come familiar with the term COVID-19 or not. So I agree fully with your remarks, Mr. Chairman, as well as the interest of the advocates who are in this room or who have sent you letters to suggest that we've got to respond. I'll let you know that personally I have also shared the same expression of concern with our federal delegation, with members of our federal delegation. I think the state of Maryland has proven itself to be a good steward of the resources once provided. The next question is, ought we be the only source of resources to establish those programs? And I think we can agree that our federal partners should be at the table as well.
Thank you for that answer. Any questions? Delegate Henson.
Thank you, Mr. Chairman, and thank you, Mr. Secretary. And thank you for addressing that. I think that it is top of mind for a lot of folks that are in the room today. When I saw that there was a $10 million increase in funding for our housing choice voucher programs, I thought that was fantastic. And I think it ties into what you're saying. A lot of the instability in our rental market is because of unaffordability. And so if families are one crisis away, then and you're in a market rate situation, then your rent is presumably going to take a large portion of take-home income. And then if you no longer have that, or if it's reduced in any way, then it can trigger that instability. So when I saw the increase in funding for housing choice vouchers, I want to understand, is that going to increase the reimbursement rate under our HAP contracts? Or will that funding open up the space for more vouchers to be issued in terms of volume?
I'm going to ask Assistant Secretary Greg Hare to join me at the table, if that's all right.
Yes, my good friend, Mr. Hare, who I call a lot. Thank you.
Good afternoon, everybody, and thank you, Delegate Henson, for the question. I think just the structure of the voucher programs, how it works is based on the market, and so as you alluded, whenever a household loses income, the voucher program steps in and pays the difference in the portion amount. So therefore, when you see people hit hard by the pandemic or other issues, the program as a whole kind of steps in. So that is the increase you see in the voucher program. It's maybe less than 50 net new units over the course of the year. So it's not really new program funding. It is a kind of a function of the market.
I appreciate that, and I appreciate the insight. And Mr. Secretary, I also appreciate the availability of the department. There are a lot of things that you all manage in your portfolio, the contract management that you do, compliance monitoring that you do for our tax credits, and a lot of times these issues are very granular and very specific to one person's challenge with their housing. And so I appreciate the availability to work through those challenges with your department. My last question is about the HAF funding and what's being allocated for foreclosure prevention. It looked to me like that funding was underutilized when the program budget is $190 million and the amount that's been utilized was $52 million. Can you help me understand the future of that?
Well, so I'll ask our Chief Operating Officer, Robin Chaconis, to respond more fully. But I believe that if you look at the multi-year, I think that was a multi-year allocation. If you look at the rate of spend, I think we're on track to spend the appropriate amount over the years that it was allocated. That doesn't mean that I don't think we could make use of more resources, but I do think that we have appropriately managed, the department has appropriately managed the resources that were allocated.
Thank you, Delegate Henson, for the question. So it is a 5-year program. We can spend the money quicker. It just depends on the number of applicants that we have coming through that we can get approved and get the mortgage assistance or the other housing-related expenses assistance, through and out to them. The challenge with that program is for the mortgage assistance, it relies on the servicers. So we get them in as applicants, we underwrite them, take a look at what they can afford, what their delinquencies are, but then we have to rely on the servicers to accept what we're recommending as payment and apply it to their mortgage. So the average applicant is coming through the door. It's going to take a good 4 to 6 months to get them all the way through the process. So what you're seeing in the budget is just the authority to spend. If the pace quickens with applicants, we would just ask for more authority to spend it faster.
Thank you for the additional insight. Thank you. Thank you, Mr. Chair.
Thank you. Vice Chair Chang.
Right. Thank you very much, Mr. Chairman. Thank you very much, Acting Secretary, for being here and the rest of your agency team. Questions I have are regarding connectivity. With regard specifically to the Affordability Connectivity Program, looks like as of earlier this year in January that there were about 50,000 households who have or part of that program. What are we doing to try to get more of these households to be part of this program? Significant investments have been appropriated for it, and also are the service providers, are they working in a seamless fashion to help households with this program?
So, Robin, I'm going to ask you to.
Actually, Rick Gordon.
Is Rick here? Mm-hmm. Oh, there he is. Ken Gordon is the Director of Office of State Broadband.
Good afternoon, committee members. So to answer that, you referenced ACP. Maryland's version is called the Maryland Emergency Broadband Benefit, MEBB. Our program provides an additional $15 per month towards a subscriber, a low moderate income subscriber's internet bill. The federal program, ACP, pays for $30 of that same expense. We tack ours on to any qualifying bill that is above that $30, we then pay. In response to the question about what we're doing to try and increase enrollment, we're currently working on a pilot program with Education Superhighway, where they work with local jurisdictions to try and better advertise the program, utilizing newsletters, utilizing other events that may be taking place. We also require our grantees for our other infrastructure programs to participate in ACP. They must provide us information on how they are promoting the program. It's actually a nationwide problem. ACP is not reaching nearly the number across the country as what are qualified for. So it's not just us. There are households that are afraid to register for one reason or another. They're registering with the federal government, and that's an issue. There are households that don't see the value in it. There are a number of different problems trying to get the word out, trying to encourage the participation. We're doing our best to address those problems.
Thank you. And are the service providers, is there a sense that they're being cooperative and being partners to be able to help get this information out and help users, subscribers?
Yes, I'd estimate 90 to 95% of the providers in the state are participating in the program, in our program, as well as the ACP program. We're putting out roughly $1.25 to $1.5 million a month in these subsidies. So that the money is going out the door. The providers are very cooperative with us as far as giving us information that we need in order to make those payments. It's really a matter of getting the households to be willing and encouraging the households to participate.
Yeah, it just seems like we can do better and more because of only 50,000 households statewide who are being part of this program. And we hear so much about connectivity issues and being able to get that access. I think it's important.
Keep in mind that 50,000 are just those households receiving our additional $15 a month. When you look at, say, Comcast that's offering Internet Essentials at $9.95 a month, none of those households get submitted to us for payment because they're all going through the federal ACP program. So the 50,000 is not the number receiving subsidy. That's the number receiving Maryland's additional subsidy.
I'll just add that we do have an outreach team. So now that you're bringing this topic up, I think it's a timely time for us to go back to our outreach team and reassess a new campaign to see if we can't get the word out more.
Yeah, that would be great, I think, because it's an important tool and really connectivity about getting families, students, and children as far as access to the internet. And I think it's an important service that we have allocated, but it seems like it's not being utilized as best as we can. So any efforts we appreciated. Mr. Chairman, if I may, one more question regarding connectivity. The Connected Device Program, the Board of Public Works approved that 145,000 devices. Where are we right now as far as getting those rolled out to really the people who really need those devices? Thank you.
So at the beginning of this week, the first 18 million in expenditures, which represents how many devices?
A little over 90,000.
So about half of those devices were awarded. We identified which jurisdictions will be receiving them, so that will be announced very soon. So the first half of those devices will be out in public very, very soon. We can also make sure that we notify you where those locations are and if any are in your district.
I think that would be beneficial. I'd really appreciate it because especially we hear so many times from students and families about not having those devices to be able to be efficient and be able to be competitive, and appreciate it.
We'll also be doing a second round, another round for application in the spring. So some of the jurisdictions, maybe that didn't apply the first time around, we'll do outreach to make sure they know about it and they're ready for the spring round.
Great. Thank you very much, Mr. Acting Secretary. Thank you, Mr. Chairman.
All right, thank you. Any additional comments or questions? Seeing none, thank you all very much. Really appreciate you coming down. Excellent maiden voyage.
Thank you very much, Mr. Chairman.
We appreciate your participation. Obviously, with 10 additional folks coming to testify, we'd ask that you stick around and listen to their testimony as well if you have the time. Thank you. So now we'd like to bring up public testimony. I will call them straight down my list. There are 10 people signed up to testify in person. We will be limiting public testimony to 2 minutes each, so please, when you hear the beeping, wrap up your comments. We will bring everybody up 4 at a time. We'll start with Claudia Wilson Randall from Community Development Network of Maryland, Nicholas Stegerwald from the Dundalk Renaissance Corporation, Matt Hill from Public Justice Center, and Lisa Klingenmeyer from Welfare Advocates. Please take a seat and feel free to start in the order I called you. I think that's probably the best way to go.
Certainly.
You're going to talk about Main Street.
I am, yes. Greeting, Mr. Chairman, members of the committee. My name is Nicholas Steigerwald. I am with the Dundalk Renaissance. We are a nonprofit development organization in Southeast Baltimore County. We also manage a Main Street. I'm here today to talk a bit about Main Street funding, although we could also talk about a lot of other DHCD programs that we are funded through. But part of that goes into the Operational Assistance Grant Fund. And I wanted to say that through the fiscal year 2022, we were able to receive around $40,000 of that funding that we were able to leverage to bring in about $430,000 of funding for Main Street programming, in addition to about $500,000 in funding for other programming work that we do. This funding has been instrumental in us being able to bring facade improvement grants to our Main Street, marketing our Main Street, seeing an increase in people coming to our events in the Main Street, as well as an increase in sales and an increase in connectivity for our Main Street businesses through a pilot program that we started that allows them to get training on how to build websites and better market themselves. Thank you.
Thank you. Ms. Randall.
Good afternoon. My name is Claudia Wilson Randall. I'm the Executive Director of the Community Development Network. We are a statewide network of affordable housing developers and community revitalization organizations across the state, from the Eastern Shore to Western Maryland to Baltimore City. And I just wanted, you have my written testimony that I prepared prior to looking at the analysis, but a few points I just wanted to re-emphasize. One, funding for Main Street in the operating budget is vital. This is vital investment for Main Streets across the state of Maryland, and it leverages at least 4 times, sometimes much more, and I just hope that we continue to fund operating support for Main Streets. Second, I want to echo all of my colleagues who will come after me in the need for emergency rental assistance. We are at a point right now that the safety net, when people are like, oh, well, the market's going to take care of the problem. The market is not going to take care of affordable housing, the need for affordable housing across the state of Maryland. It is an urgent issue. We need emergency rental assistance. It would be great to see $175 million, which would only help 20,000 families, but we need assistance. And the federal assistance was able to really stop any eviction crisis from happening during the pandemic. But post-pandemic, that assistance is going to go away. We're going to need it. And we want to continue to be a state with opportunity. So I just want to emphasize the need for emergency rental assistance. You've already talked about that. Also, there's also vital need for homeowner assistance as well. The homeowner assistance is going to have a very big impact on low-income older adults in the state of Maryland. And we need to keep as many low-income and middle-income older adults in the houses they're on. There is not enough, there will not be enough rental assistance, and we are coming to a time where 14% of the population in Maryland will be over the age of 65. We are coming to that in 2030. And there's an urgent need for people who are older and for people who are disabled. And we have got to figure out this homeowners assistance program to address that need in particular. And those people do not have access to email or an email account. They are not digitally literate. And the program, and this is not a Maryland problem, this is a federal problem. But to set up those programs where access depended on an email account is not right. Okay, you mentioned the broadband subsidy, so I'll hop over that. But the broadband subsidy, in my view, needs to be braided with the homeowners assistance program and the emergency rental assistance. That's the only way we're going to get is for those programs, for those broadband programs to be braided with other programs that are around human services. It's critical that we do that. And finally, my fourth point is that the Baltimore Regional Neighborhood Initiative, Bernie, should have $2 million in operating. For some reason, it got stripped out. It's at a number like 4, and the operating number now is 499,864 or something like that. It should be $2 million for operating. The organizations in Baltimore City by far struggle for operating funds and operating capital in order to spend the capital funds that are in Bernie. So with that, I'll stop and turn it over to my colleagues to talk about rental assistance. But thank you so much for the opportunity to speak today.
Thank you. Mr. Hill.
Good afternoon, Mr. Chair, members of the committee. My name is Matt Hill. I'm an attorney at the Public Justice Center, which is a member of the Renters United Maryland, as well as the Maryland Emergency Rental Assistance Coalition. I want to thank you for your remarks and asking that direct question about emergency rental assistance. That's why I'm here today, and I want to acknowledge and appreciate Secretary Day's remarks, and we stand ready to partner on that shared interest. I would add, though, that there is a level of urgency here. As you pointed out, the funds are running out in March or April. If we wait for Congress, in which half the Congress wants to, default on the nation's debt, we're going to be waiting a very long time. And there are people being evicted right now. So I really do urge this body to take that sense of urgency and live it out. Because if Maryland is serious about leaving no one behind, that has to include renting families who have had a financial setback, like a medical emergency or a job loss, and are facing eviction. If the pandemic taught us one thing, it's that an emergency setback does not have to end in tragedy and eviction. The program worked. We had record low evictions because of the emergency rental assistance, because of the protections that this body put in place as well as increasing access to legal representation in eviction proceedings. Everyone wants to talk about racial and gender equity. This program is racial and gender equity. When you look at who is assisted, 70% of the families that avoided eviction with emergency rental assistance were led by women. Almost 80% were Black and Latina households. It was a massive success in that respect. At the same time, evictions are now rising, and we're moving back toward pre-pandemic levels. And so we really need the governor and this body to act. And again, we stand ready to partner with you and appreciate you, and have left other sort of suggestions about including tenant protections, forming a work group, making sure you can study best practices so that we can do this even better in the future. Thank you.
Thank you. Ms. Klingenmeyer.
Thank you, Mr. Chair and members of the committee. My name is Lisa Klingenmeyer. I'm the Assistant Director of Advocacy at Catholic Charities of Baltimore, and I chair Welfare Advocates. We're here today in support of the Department of Housing and Community Development and of its budget, and also here to urge state investment in emergency rental assistance. Catholic Charities is a provider of emergency rental assistance. We help folks in Baltimore City through the Samaritan Center, and we were an ERAP provider in Baltimore County. And I asked our caseworkers how the program was going, and they said demand is overwhelming and consistent. And when I asked our administrator what's going to happen when the federal funds run out if there's no more investment, and he said it'll be catastrophic. We are a large service provider, and there's no way for us to meet this demand without additional state or federal investment. The scale is just much too large, and the demand is much too big for us to be able to meet. We need some sort of additional investment in emergency rental assistance to help the low-income families coming to us. Otherwise, they will start to be the families that we are serving in our homeless shelters and in our soup kitchens. I know that a lot of the metrics around the economy right now are looking good, job growth, unemployment, but we know it takes the longest for families with the lowest incomes to recover. And low-income families have long struggled to obtain housing assistance. The problem isn't new. I talked to this committee a lot over the last 8 years about deep poverty and the work that we can do in Maryland. But what is new is that over the last 2 years, we've created this massive system to disseminate rental assistance on a scale we've not done before as a state. And we really should maintain the system that we've created. We know that stable housing is a cornerstone of family well-being, and that thriving families mean a thriving state. And so we look forward to working with Acting Secretary Day and this body to figure out how we can have a sustainable way for Maryland to be able to meet the emergency rental assistance needs of our communities. Thank you.
Thank you. Are there any questions for this panel? Delegate Henson.
Thank you, Mr. Chairman. We were advised about the tsunami of evictions that would happen if there weren't robust rental assistance programs. Those tsunami of evictions did not happen, and I think sometimes it can be desensitizing when we are warned about, things that could happen at catastrophic levels. But what I hear you saying is that some of the features of the programs worked effectively exactly as they should, and that we do have a pattern here for how to be successful with preventing those evictions, if I'm hearing you correct. I want to ask about, for those of you who are practitioners or anyone in the panel that would like to comment, our DHS department has funding as well for eviction prevention. Anybody that's familiar with the mechanisms of how a tenant can get assistance there, can you give us any sort of insight on how that could be effective in partnership with DHCD, or if you look at the programs as wholly separate, or any additional insight to help us in guiding forward?
I can speak, Delegate Henson, to how that worked pre-pandemic, because that was the only source of funding, and I was very familiar with that as it played out in Baltimore City. It was a very meager program, frankly. There was a limit of up to, I think it was $1,200 over the course of a year that a tenant could obtain. The tenant had to jump through many, many hoops, and the money would always run out around month 5 of the year. And so for the other 7 months of the year, there was nothing. And what there was for those 5 months were for people who were lucky enough to jump through many, many hoops for a very meager amount of money. And so it was wholly inadequate. And I think that your first comment is absolutely on point. This program helped 100,000 Maryland families avoid eviction over the course of 3 years. That's incredible. We've had record low evictions. And again, it wasn't just the emergency rental assistance. This body took other action. But we don't want to go back to the bad old days. And that's the opportunity we have right here to build back better. And I hope that Maryland does.
Thank you. I appreciate that. Thank you, Mr. Chair.
Thank you. Any other questions? Seeing none, thank you all very much. We'll call up the next set of witnesses. Scott Gottbreit from the United Way of Central Maryland, Alex Vasquez from CASA, Warren Buff from Community Legal Services of Prince George's County, and Sarah Price from the Maryland Retailers Association. Mr. Gottbreit, please begin.
Great. Thank you so much, Mr. Chair, and thank you to the members of this committee. My name is Scott Gottbreit. I'm Vice President of Housing at United Way of Central Maryland. Our organization is managing $100 million of the funds that have come to Maryland for emergency rental assistance. We've assisted 11,000 households to date. 1 in 10 households that have been assisted in the state have come across our program. I here today support additional emergency rental assistance funding, in part to attempt to recharacterize the debate somewhat. Many folks have been describing that the pandemic is behind us and the economy is improving, but what we have here is a rent debt crisis, not simply an income crisis. And one of the things I explained to my students at Hopkins is that there are 2 types of money, or it's useful to conceive of 2 types of money. There's income, and then there's net worth. You might also add savings or credit, or credit to that equation. But households that lost their income in 2020 and 2021 may have accumulated 3 to 6 months of rent debt. And even if and when they began working again full time and making regular rent payments, nonetheless they were stuck with 3 to 6 months of rent debt, which remains with them to this day. Households that have regained full employment find that those dollars are stretching not as far as they used to with rising costs of living. And that means that they have little, especially the lowest income folks have little at the end of the month to pay down on rental arrears. And as the Department of Legislative Services articulated, there's something on the order of $375 million of outstanding rent debt in the market, which is a massive burden for landlords and tenants alike to bear, including especially the lowest income renters. The Maryland Emergency Rental Assistance Coalition, which has the support of 6 county executives and the mayor of Baltimore City, as well as 50 nonprofit organizations, has assembled a wonderful and informative fact sheet, which I'd be happy to circulate, but has some of the figures that are quoted today, as well as a range of funding options. So you don't have to just say $175 million, which was the original recommendation, yes or no, but what could we do with $50 million? What could we do with $250 million? And what are the options in between? And what are the implications for that for the households we're choosing to assist and not assist? We say no households left behind. 52% of those with rent debt are families with children, and 1 in 10 evictions will lead to homelessness. Thank you for your time today.
Thank you. Mr. Vasquez.
Hello, everyone. Good evening. Good afternoon. It's almost about to be evening. My name is Alex Vasquez. I'm the Montgomery County lead organizer for the CASA organization. And while I do a lot of great work in Montgomery County, today I'm also here on the behalf of all the districts that we work in Baltimore, Prince George's County, Anne Arundel, and so many more communities in Maryland. There's been a lot of talk today, and I just wanted to give you a more on-the-ground perspective. Right now, we have a lot of families who are barely just digging themselves out from the pandemic. And the rental assistance program has brought a lot of relief and has prevented a lot of evictions within our communities, especially our Black and Brown, and most importantly, our undocumented communities, which we often forget about. But as renters continue to dig themselves out, they are now facing high rent costs. They are now facing a lack of affordability, a lack and shortage of affordability, sustainable, and safe housing. And so I urge everyone to be a little cautious when we say that, the applications aren't as high as they used to be. For example, Montgomery County, you need to be at least 2 months behind before you can even apply. So we have actually a wave of renters who could be a month behind, but just because they're not able to apply, they're not presented in the statistics. So I urge the body to please consider funding this program. It is essential for our community members, a lot of them who contribute greatly to our societies. And thank you for your time.
Good afternoon. I'm Warren Buff. I'm an attorney with Community Legal Services of Prince George's County. I provide same-day eviction defense to tenants facing eviction. Our organization does that in both Prince George's and Anne Arundel counties. We support HB 200 and urge the committee to issue a favorable report with amendments. What I hear from my clients almost every time we start to talk is, I need more time. They say that every time their landlords bring them into court, they know they need to pay the rent and they want to pay the rent, but injury, illness, a car accident, unemployment, forces beyond their control have set them back a few months, and they need some time and a little grace to catch up. But as they're struggling to catch up with job loss, with rising rent, they repeatedly have to take time off from work to come to court, which further delays their ability to pay. We have some community organizations that try to help, but many of them are stretched beyond their limits and just don't have anything left to give. I provide a list of charities to clients to reach out to for rental assistance, and they say, I've called all of these numbers, they have nothing. And we often see 100 people show up at the court on any given day, other than Wednesday when they don't do rent court in Prince George's County. But even more than that don't appear. Most of them are there because they're behind on the rent. So 4 days a week, at least 100 people showing up. Now, not all of those cases go forward, but the landlords are still filing writs of eviction on hundreds of people a week. You often only ask the court to stay its eviction, to give time for rental assistance. And we find that our clients are willing to take a judgment and damage their credit because that is what the ERAP program has told them they need to do before they can even apply. So we do encourage you to fund this at that $175 million level. Thank you.
Thank you. Ms. Price.
Thank you, Mr. Chair, Madam Vice Chair, and honorable members of the subcommittee. My name is Sarah Price, and I'm here on behalf of the Maryland Retailers Association. We partner with the department to support the mission of the Main Street Maryland program, and I'm here to emphasize the importance of preserving funding for the main streets. The Main Street Maryland program preserves local historic and cultural resources while supporting small businesses and promoting new investment and development. There are 33 officially designated main streets in Maryland and 8 additional neighborhood main streets that are managed by the City of Baltimore. And these 41 main streets all have access to apply for project funding from the Main Street Improvement Program, which is a line item under the Division of Neighborhood Revitalization. The improvement program provides much needed project funding that the main streets can use to execute projects like advertising campaigns, facade improvements, updating their economic plans, and they can even use it to leverage matching funds to get additional grant sources. Nick from Dundalk provided several excellent examples of the ways that they've been able to use this funding in past years. We've consistently advocated for these funds to be increased in the state budget, as it sat at about $400,000 for several years, and that doesn't go very far between 41 main streets. In fiscal year 23, Governor Hogan increased that amount to $1 million, and DHCD was able to then provide equal funding to every single main street. And for some of these communities, it was the first time that they had received funding in years from this pot. Governor Moore has generously maintained that $1 million for fiscal year 24, and we would just like to urge you to please maintain those funds moving forward so that our historic epicenters can continue to thrive. Thank you.
Thank you. Any questions for this panel? Vice Chair Shetty.
Thank you, Mr. Chairman. This question is for Mr. Vasquez. Hello. It's good to see you here today. I'm curious if you can share, I know you and I have worked together on a number of constituent cases related to really precarious housing situations that tenants are in across our state. And through that effort, I know we sort of discovered locally that there were gaps in availability of programs to address some broad needs that seem to exist. And I'm just wondering if you could sort of share a tiny bit of your perspective on where those gaps are that maybe DHCD in partnership with the legislature could potentially address.
Yeah, thank you very much. And it's great seeing you again. As you said, we've done a lot of great work at the local level. So there's a lot going on right now with many residents throughout the state of Maryland. And I'm just going to use the example in Montgomery County. Right now, there are a lot of tenants who are not only falling behind on rents, but unfortunately have no accessibility to move around because there's an extreme lack of affordable and safe and sustainable housing. In the instance where Delegate Shetty and I had, toured a community in Rock Creek Apartments, we found tenants who were living in deplorable conditions, mold, mice, flooding, plumbing, and so much more. And unfortunately, our system is at such capacity, so backed up that they're lacking capacity to keep up not only with some of the requests that tenants are reporting to the county, but the physical ability to actually get out there and enforce some of these codes and conditions. And so, organizations, as some people had mentioned, including CASA, are stretched extremely thin. A lot of tenants are afraid of retaliation. In this example, we actually just received 3 or 4 residents who received a non-renewal notice because they spoke up about the conditions. And so there's a lot of complementary policies that we are fighting for at the state level, such as Just Cause, the Tenant Safety Act that really gives tenants the power to not only collectively organize, but to hold their landlords accountable when they are not choosing to meet the standard that is provided in the contract. But as we saw, there are a lot of loopholes at the local level, and I think that, in my personal opinion, a lot more funding can come our way towards organizations that really help do the groundwork effort, but even some of our housing agencies throughout the jurisdictions that are having trouble keeping up with the demands of just the housing needs and just conditions-based problems that we are seeing.
Thank you so much. Any other questions for this panel? Seeing none, thank you all very much for coming to testify. We have 2 more people signed up to testify in person. Call up Jennifer Santana and Ivy Wells.
I'm going to be translating for Ms. Jennifer. That's okay.
That's perfectly fine. Thank you.
Buenas tardes. Mi nombre es Jennifer Santana, soy de la República Dominicana y vivo en el condado de Montgomery, en el distrito 20.
Good afternoon. My name is Jennifer Santana, and I am from the Dominican Republic and live in Montgomery County, District 20.
Soy esposa, madre de 3 hijos. Conozco de primera mano la dificultad de no tener un techo y digno para la familia.
I am a wife and a mother of 3 children, and I know firsthand the difficulties of not having a safe and dignified roof.
Mr. Vasquez, why don't we pull both microphones over temporarily, if we can? I think that might be a little easier.
Thanks.
There we go.
Me tuve que quedar en casa para cuidar de mis 3 hijos, obligándome a solo tener la fuente de ingreso de mi esposo.
I had to stay at home to take care of my 3 children, forcing us only to have one source of income, which was my husband's.
Gracias a Dios y al condado de Montgomery pudimos aplicar para los fondos de asistencia para la renta, los cuales cumplimos con todos los requisitos y nos aliviamos por unos cuantos meses.
I thank God and the county, Montgomery County, for the opportunity to apply for rental assistance funds. Fortunately for us, we met all the requirements and qualified for relief for a few months.
La asistencia de renta permite tener un techo seguro, combate el hambre, la incertidumbre de mañana, permite que nuestros hijos vayan a la escuela sin miedo al desalojo o no tener un techo.
Having the emergency rental assistance allowed us to keep a safe roof over our heads and helped,
Okay. Muchas familias del estado de Maryland estarían muy felices si nos aseguran que estos fondos continúen. Creo que es un deber del Estado velar por las necesidades y la seguridad de nosotros como ciudadanos.
The rental assistance funds in many families in the state of Maryland can breathe a sigh of relief and, have benefited a lot from these funds.
Hoy estoy aquí haciendo un resumen de mi testimonio y sé que muchas familias del estado de Montgomery de Maryland se identifican conmigo. Gracias a toda la comisión de delegados por escucharme y apoyar este proyecto de ley para asegurarnos que nuestras familias no sean desalojadas.
And that's why I'm here today to share my testimony with you, because I know that many families in the state of Maryland identify with my struggle. Thank you to the committee for listening to me, and I urge you to add more funding to the rental assistance program to ensure families like mine don't face any more evictions.
Gracias.
Thank you, Mrs. Santana. Ms. Wells, please.
Good afternoon, Mr. Chairman and committee. My name is Ivy Wells, and for the last 8 years, I've been the Economic and Community Development Director for the town of Berlin. I was also on the board of the Community Development Network, Claudia. Previously, I started the Main Street program in Sykesville, Maryland. I grew up in Laurel, Maryland, where I spent most of my time on Laurel's Main Street. I've heard everyone talk about funding and what funding can purchase, and you all know what the Main Street funding can tangibly buy. But what I want to talk about is the story of one particular business owner who started a business in Berlin, where she grew up, where in the 1960s and 70s, she wasn't allowed to go into some of the businesses in Berlin. She started out as a volunteer in the Welcome Center and worked her way up to a part-time position, realized that she had enough funding to be able to purchase the business, and now owns a business in downtown Berlin. And she said to me before I came here, she said if it wasn't for the improvements that some of the funding of DHCD did, and with the events and with the revitalization of downtown Berlin and all the downtowns in the state of Maryland, she never thought in a million years that she would ever be able to open up a business in downtown Berlin. So I very much appreciate to maintain the funding, appreciate to work with. I always call Mayor Day. So that's my testimony for today.
Y'all were neighbors for a while, so that makes sense. Thank you so much. Any questions for this panel? All right, seeing none, thank you all very much. Really appreciate it. Before we adjourn, just as a reminder to the subcommittee, we do have 32 additional pieces of written testimony that you may want to take a look at today. This subcommittee will meet again on Monday for a joint briefing with HGO on various important topics. And then on Wednesday, again, we will be back here on various budget hearings, including the Department of Health's professional boards and commissions, Public Health Administration, Prevention and Health Promotion Administration, as well as the Department of Human Services Home Energy Program. So hopefully that's all in your calendars. With that, thank you all very much. We're adjourned.